Record. All right, Dr. Wang, go ahead.
All right, I'll be talking today about colorectal cancer. Next slide.
Sorry, I had a hard time with the shifting.
All right, go ahead, next slide. All right, so colorectal cancer refers to cancer that starts in the colon or rectum, which is the last part of the digestive system where stool collects before you evacuate it with a bowel movement. It's actually the third most common form of cancer diagnosed in men and women in the US. So it's very common, even though it's not talked about as much as some of the other cancers like breast cancer or prostate cancer. The good news is that the number of people dying from colorectal cancer has declined over the past 20 years. And we know that screening for polyps or screening for early colorectal cancer is the best way to help patients prevent them from dying from colorectal cancer. So removing precancerous polyps, which are abnormal growths in the colon, is a great way and the best way to prevent colon cancer from happening. Now, in terms of signs and symptoms of colorectal cancer, so these are listed some of the most common symptoms that can occur. They include changes in bowel movements, especially if you have new onset constipation, which is new for you, because that could indicate that a new colon cancer is blocking the movement of stool. Blood in the stool is one of the most common symptoms that can occur with colon cancer, although other things can cause blood in the stool as well, such as hemorrhoids. But it's always important to get it checked out and not just assume that it's hemorrhoids if you have blood in the stool. Abdominal discomfort, unintentional weight loss, constant fatigue, or vomiting. However, it's important to remember that early colon cancer may not have any symptoms at all. And that's why it's so important to get screened, even if you're feeling well and not having any symptoms. Now, as far as diagnosing colorectal cancer, listed here are the types of tests that can be used to most commonly diagnose colorectal cancer. They include physical exam. Patients will often have abdominal pain on physical exam. Colonoscopy is by far the most common way to diagnose colon cancer. And with colonoscopy, we're using an instrument that has a video camera on the tip of it and putting it in through the colon so we can get a direct view of everything inside the colon, and we can detect colon cancers that way. Patients are put to sleep for the colonoscopy, so it's they're comfortable during the procedure. Blood tests, blood test is listed here. It's not a primary way to diagnose colorectal cancer, but it can give some support or supporting information. For example, many patients might present with anemia, which is low blood count. And so, if they've had normal blood tests, but then all of a sudden their blood tests show a low red blood cell count that's unexplained, that could be a sign of colon cancer. There are also some tumor markers like CEA, which can be abnormally elevated in the case of colon cancer as well. Imaging tests or scans, most commonly CT scans, can also be used to diagnose colorectal cancer, although oftentimes it wouldn't show up on a CT scan until very late stages. So an early colon cancer, which might only be a few centimeters in size, depending on the location, may not always be detectable on a CT scan. So that's why colonoscopy is important. And then surgery, I guess if you were doing surgery for some other reason, or if a patient had a blockage in the colon and they had to get surgery to remove the blockage, but it wasn't clear what was causing the blockage, during surgery, you might diagnose a new colon cancer. Now, as far as biomarker testing, there's been a lot of research going on in the last few years with biomarkers. And basically what biomarkers refers to are genetic mutations in the cancer tissue, and that might explain how that cancer developed. And so, for example, things that are tested for in a new colon cancer tissue would be microsatellite instability or DNA mismatch repair deficiency. And these all refer to mutations, genetic mutations. In addition, you can see listed here if you have metastatic or advanced colorectal cancer, there are some other mutations that are good to be tested for as well. And the reason why it's so important to get tested for these genetic mutations is that it can help guide treatment, because now with a lot of research, there are treatments that are being designed to treat the exact mutation that is causing the specific colon cancer that the patient has. So not everyone with colon cancer is getting the same treatment. It all depends on their specific type of colon cancer. So when someone is diagnosed with a new colon cancer, the first thing that doctors do is to do staging. And what that means is, how extensive is the colon cancer? And with staging, there are three main factors that we consider when determining stage. One is the size of the tumor, how many centimeters is it? Also, whether or not it's, how deep is it? How much is it growing into the wall of the colon or adjacent organs? Then the second thing we look at is lymph nodes. Lymph node, we look at whether or not the cancer has spread to any neighboring lymph nodes. And then finally, we look at any evidence of metastases. Has the cancer spread to other organs, such as most commonly the liver or the lungs? And these are all, this is all data that is gathered with the combination of imaging, such as CT scans, as well as surgery. For example, with surgery, they would often take some samples of the lymph nodes in the surrounding area and check them for cancer. And so with all of this information, then we can come up with the stage of cancer for the patient. So here you can see kind of a pictorial graph of the different stages and what they generally represent overall. So with stage 0, that's considered pre-cancer, is not a cancer yet at stage 0. So that refers to the polyp stage. And as I mentioned before, polyps are abnormal growths in the colon that are abnormal tissue that is not yet cancer, but has a potential to turn into cancer. And so that's why colonoscopy is so useful, because when it's still in the polyp form, it can be easily removed during a colonoscopy. And once it's removed, then cancer is prevented. And so that's why colonoscopy is such a great test to prevent colon cancer. Now with stage 1 colon cancer, the tissue, the polyp has changed into a cancer, and typically it takes about 10 years for a polyp to go from the polyp stage to cancer. And the cancer tissue has started growing into the wall of the colon. Now at stage 2, it's grown even more into the wall of the colon, typically through the entire wall. And then in stage 3, the cancer has started to spread into the lymph nodes that are nearby. And you can see those green circles representing the lymph nodes. And finally, in stage 4, the cancer has spread to other organs, such as the liver, spreading through the bloodstream and the lymph nodes. So it's important anytime someone is newly diagnosed with colon or rectal cancer that you realize there's a whole healthcare team that's there to support you. There are multiple doctors that you might see, such as a surgeon who would do the initial surgery to remove the colon or rectal cancer, if it's possible to remove it. A medical oncologist is responsible for giving chemotherapy and kind of is the overall doctor who manages the cancer. Radiation oncologists, they give radiation therapy. The oncology nurse practitioner works in conjunction with the medical oncologist and radiation oncologist, and usually is your primary point of care with the oncology team. And so that's the person you'll probably be speaking with most often. A social worker helps with financial issues or social support issues. A nutritionist will help with making sure you get adequate nutrition, especially if you have to have chemotherapy or other things that might, other treatments that might make eating regularly difficult. A patient navigator is usually at many cancer centers, and patient navigator basically kind of holds your hand as you go through all the different steps of the treatment process, because it can be confusing being newly diagnosed and having to find your way through all your appointments with all these different doctors, and so the patient navigator helps you to navigate all of those issues. Pharmacist, it helps with all of the new medications that patients might have to take. Primary care physician is still your overall, doctor and advocate for you. Financial counselor helps with billing and treatment. So the billing, the costs of treatment. Now, when you go to your doctor's appointments, it's important to be prepared. It's oftentimes patients are very nervous and very anxious about what the doctor might say. And so you might have all these questions that you've thought of in your head, but once you actually meet the doctor, you're so nervous that you forget what you were thinking about. So that's why it's important to write those questions down. And I often have questions from patients who bring a long list of, written questions, which I don't mind. And then they just read them off their list during the appointment. Make sure you tell your healthcare team about any side effects or symptoms that you might be having from the treatments, or new symptoms that have come up since your initial diagnosis. Also, it's important to tell your healthcare team about other medications that you might be taking, especially over-the-counter medicines that many patients forget to talk about, because some of those other medications can have side effects too, or might interact with your treatment. For example, people might not know that some of the over-the-counter pain relievers like ibuprofen or Advil or Motrin, they actually can have a side effect of increasing your bleeding risk. So that's why it's important to tell your doctors and your healthcare team about all medicines you're taking. It's often helpful to have a friend or relative come with you to your appointments. Again, oftentimes the patients are so nervous that they might not remember what the doctor's saying. So having that other support person with you is someone else who can remember what's being said. And don't be afraid to ask for copies of your test results. It's a lot of patients keep their own medical chart, their own personal medical chart. And that's very helpful, especially if you're getting care from multiple health systems where, one hospital might not, or one clinic might not have access to records from another hospital. And so it can be helpful if you collect all that information. So as you go to see the different doctors, if they're not able to access those outside records, you might have them in your own personal file. The other thing is, don't be afraid to ask for a second opinion. It is your right to get multiple opinions, not only a second opinion or even a third opinion. It's your life that is in balance here. And you want to make sure that you're getting the absolute best treatment that you can that will give you the best chance for fighting this cancer. It's actually very common that patients get multiple opinions, especially if it's not a straightforward situation. And even if you get a second or third opinion and they all say the same thing, at least you can be confident that that you're getting the right treatment. Most doctors should be fine with you getting another opinion. It's, kind of a routine thing in medical practice. And, you shouldn't worry about having to hurt their feelings, your initial doctor's feelings. Everyone's used to this. So don't be afraid to ask for another opinion. And I'll mention some large cancer centers will offer second opinions remotely so that you don't have to travel, in person. Oftentimes they can just get all your test results and pathology and analyze it and can provide a second opinion that way without you having to actually travel there in person. So what affects treatment decisions once someone's been diagnosed with a new colon cancer? Well, with all cancers, these are the factors that affect what treatments will then be recommended. The type and stage of the cancer, the results of the genetic testing or biomarker testing, because as I mentioned, there are now new treatments that are available that specifically target the genetic mutations that specific cancer has. Your age and overall health can play a factor. Your medical history, your response to certain treatments, and also your willingness and ability to tolerate certain side effects. Some patients might be, wanting to fight the cancer no matter what, even if it means taking a very toxic treatment that could cause a lot of side effects, but might give you your best chance for cure. Whereas other patients, quality of life is the most important, and you want to balance, the side effects with the effectiveness of the treatment. And so it's a very personal decision and something that you should definitely talk with your doctors about. Now, in terms of goals of treatment, this also depends on the stage of the disease. For early disease, the goal is cure. And with colon cancer, it is one of the most curable cancers. So with early colon cancer, if it's just stage 1 or even stage 2, and it's just grown in the colon, then it can be easily removed usually with surgery, and you can be cured. And so the goal is to, with surgery, remove the cancer cells completely, or with sometimes people might use chemotherapy to shrink the tumor or kill the tumor prior to surgery. And then with chemotherapy, if there was any question about negative margins with surgery, sometimes chemotherapy is used to just make sure that it's killed off any microscopic cancer cells there to give you the best chance of survival without having to worry about the cancer returning. Now, for advanced disease, this refers to metastatic disease, metastatic cancer. The goal there is not as much cure, but more delaying progression of the cancer. And so, we want to try and delay the growth of the cancer cells as much as possible, try and give you your best quality of life. But, I would say medical research and treatment has advanced so much that even with advanced disease, sometimes there can be a possibility of cure. For example, some patients with colon cancer, if they have metastases in their liver and it's just 1 or 2 metastases, sometimes surgery can be used to remove those areas of the liver and the goal would be cure, even though the cancer has spread to the liver. If with the combination of surgery to remove those metastases plus chemotherapy, there are some people who are able to be cured even, with advanced disease. So everyone responds differently to treatment. And so it's definitely important to communicate with your healthcare team as far as your goals for treatment and your responses as you go through the process. Now, as far as types of treatment, they're listed here, and I'll go into a little more detail for each of them in the following slides. So we talked about surgery already, as far as, being the primary way to remove the cancer. Surgery might be done with laparoscopy, which is a minimally invasive approach where they just make little small incisions and use instruments to remove the cancer. So you're not getting a big, huge incision. And with laparoscopy, recovery time is a lot shorter. But sometimes you can't avoid having to do the traditional open surgical resection where you would have a large incision, just depending on the location and the size of the cancer. Now, in some cases, a colostomy or ileostomy is required, and this refers to the bag that is, on the abdomen where the colon or small intestine would come out directly onto the skin of the abdomen, and you'd have a bag collecting the stool. That is performed more often in rectal cancer than colon cancer, and it can be temporary or permanent. So sometimes at the initial diagnosis, if someone, for example, had a blockage from their cancer and they didn't know what was going on, and the first time they went to the hospital, they had this big blockage from the cancer, then a temporary colostomy might need to be done in the process of cutting out the cancer. And then later on, a few months later, then another surgery could be done to reconnect the colon. So a colostomy is not always a permanent thing. Ablation is another form of treatment that's done, and that has to do with ablation means using a high heat treatment to destroy the cancer tissue and also treat small tumors. So this is typically done on liver metastases, where they will use ablation to kill the tumor in the liver. Chemotherapy, as you all probably know, it refers to using drugs or medications to kill cancer cells. It's typically given through an IV where it goes directly into the bloodstream, or it can be given in pill form. It just depends on the type of treatment that's recommended. Now, chemotherapy can be given at different times in the treatment process. Sometimes it's given before surgery, and in that case, maybe the cancer is very large and might be growing into organs nearby and would make surgery hard to remove it. So sometimes they might use chemotherapy first to try and shrink the cancer. And then after the cancer has shrunk, then it'll be a lot easier to remove with surgery. Sometimes chemotherapy is used after surgery. So after the cancer has been removed, then chemotherapy can be used to prevent recurrence of the tumor. Radiation is another treatment option, more commonly for rectal cancer, just because of the location of the rectum. Sometimes it's hard to completely remove all of the cancer, and so radiation can be used to treat any remaining cancer that might be present after surgery or even during surgery. And chemoradiation just refers to a combination of chemotherapy and radiation therapy given during the same time period. Now, targeted therapy I mentioned this before, and this has to do with, looking at the cancer tissue to see if there are specific gene mutations that are present in the cancer tissue. And then depending on those genetic mutations, then there's certain treatments that can be done. So some genetic mutations will have a specific type of treatment, like chemotherapy, that would be specifically designed to attack those genetic mutations. And so that's really kind of the front line, or most advanced therapy that's out there is this targeted therapy. And this targeted therapy is great because it just really targets the cancer tissue and not so much the normal tissue. And so there's usually less risk of side effects with targeted therapy. However, with targeted therapy and especially with just general chemotherapy, there definitely can be lots of side effects that patients have, and there are just some of the side effects listed here. These are very common side effects, and so with a lot of these side effects, there are medications or things that we can do to help decrease or minimize the side effects that might happen as a result of treatment. All right, immunotherapy is one of the newest types of treatments that's become available. And what this does is to really rev up the immune system in a way so that it utilizes the body's natural immune system to help it to identify and kill the cancer cells. So there are some specific immunotherapy treatments that have been developed for colorectal cancer, which are listed there. And so again, these are treatments that can be given with specific types of colon cancer with specific genetic mutations. So as far as side effects, as I mentioned, there are lots of supportive medications that can be given both before and after and during treatment to help manage these side effects. So definitely talk with your oncologist about what to expect and what are things that medications that you could have on hand in case you get any of the side effects. Certainly there are some bowel issues that can occur as a result of the colon cancer. And I mentioned before that obstructions or blockages can occur or perforations. So if a colon cancer is growing very large, it can actually cause a complete blockage in the colon. And so that would be an obstruction, but then it can also cause a perforation. If the colon cancer has grown into the wall of the colon, it can cause a hole in the colon or perforation. And symptoms, common symptoms we kind of went through before are listed there: abdominal pain, nausea and vomiting, bloating, inability to pass gas, constipation more often than diarrhea, and loss of appetite. So these are all symptoms that can occur, especially in the setting of a blockage. And there are lots of clinical trials going on to look for new treatments for colon cancer. And so, definitely talk with your doctors about whether or not you might qualify for any clinical trials, especially if you have not so straightforward situation, or if you're not responding to the standard treatment. It's important to keep in mind that even if you do join a clinical trial, you can leave at any time. You're in control there. So you can, if you decide that you started it out and you tried it, but you don't like what's going on, you can always leave the trial at any time. And then always keep in mind palliative care. Most hospitals have a palliative care team now. And these are doctors and nurses and staff who are really having the primary goal of maintaining quality of life. And, oftentimes in the hospital or in the clinic, everyone's focused on treatment. But with palliative care, they're really looking at more of a holistic picture. And, how can we balance the treatment with making sure you're able to maintain quality of life? Now, it's important to remember that palliative care does not mean hospice care. The difference is that hospice care, with hospice care, you've decided not to pursue treatment or curative intent, like you're no longer trying to treat the cancer. Whereas with palliative care, you could still be trying to treat the cancer, but you're just wanting to involve a team that will also help you with your quality of life. And as far as follow-up care, so after being diagnosed with colon cancer and after getting your treatment, then these are the guidelines here for what to do afterwards, after your initial treatment. So after surgery, the recommendation is to get a colonoscopy 1 year later. And if it's normal, then you would repeat in 3 years. And if that's normal, then repeat every 5 years after that. If on that first 1 year colonoscopy, there's an advanced adenoma, and what that means is a large polyp, then you should repeat the colonoscopy in another 1 year and then go from there. And this also gives other information about other imaging studies and blood tests that is recommended for stage 2, 3, and 4 cancers.
Thank you, Dr. Wang. I'll go ahead and take it from here. We'll be talking a little bit about coping with colorectal cancer. So colorectal cancer can definitely impact your sexual health and your fertility. So before you start any type of treatment, remember it's important to talk about fertility issues with your doctor. If you're planning a family, another option would be to see a fertility specialist before you start any type of treatment. And it might be hard for people to discuss our sexuality or our sexual health, but it's very important that we find a member of our healthcare team that we trust, that you can ask questions and talk about your sexual health. Our sexuality comprises a broad range of both feelings and actions, and it's definitely something that is worth taking the time to address properly. So living with colorectal cancer can be both physically and emotionally challenging. There are some common emotions, associated with any type of cancer diagnosis. Anything from feeling sad and alone to being anxious or depressed. It is actually possible to find a balance between your medical, social, and emotional concerns if we bring them up with our team and address them. As far as your emotional wellness goes, it's quite common to experience some increase in anxiety. But what you want to look for is if it is having an impact on your daily life. So are you having persistent worry? Is it impacting your ability to rest or sleep? Are you having other symptoms of heightened anxiety, like feeling too nauseous to eat, or maybe having heart pain or an increased heart rate, or hypervigilance? Those are indicators that your anxiety is possibly to a problematic level. Same thing with depression. Depression is very common, but is it impacting your daily functioning? Maybe crying jags, or not being able to control your crying, losing interest in things that you used to really enjoy, becoming kind of apathetic to those things, or again, any type of eating or sleeping disturbance would indicate higher levels of depression. The good news about that is there are many ways that you can treat anxiety and depression and other cancer-related emotional distress symptoms. So one of the really helpful ways to do that is through a support group. Cancer Support Community offers support groups to people living with cancer, to people who are friends and family members or caregivers. And the things you learn in support groups can help you navigate your diagnosis. It helps you manage your anxiety and feel less alone. You also learn about resources from others. So there's just sort of a community, a sense of community and shared knowledge. People who get involved in support groups report a decrease in depression, an increase in well-being or a zest for life, and a new attitude toward their illness. They feel empowered by the knowledge that they receive in their support groups. There are also other kinds of support that you can utilize, such as individual therapy, spiritual counseling, or advocacy. And it's important to remember the other strategies for wellness that we can employ, such as physical activity. Even if you don't feel like you have the energy to go to a gym or even go on your regular walks, make sure that you at least walk up and down the street as far as you can, or do some gentle stretching, or maybe even some chair yoga. Remember to eat as healthy as possible. There are lots of ways that you can get nutrition, even from smoothies and soups and comforting foods like that. Cancer Support Community offers nutrition classes and cooking demonstrations where you can learn healthy recipes that are easy for people who are going through cancer treatment. Definitely remember to get plenty of fluids and create your own personalized care plan. And we can't forget the caregivers. Cancer impacts caregivers just as much. So remember to take care of yourself as a caregiver. Join a support group, talk to others, be in community with other caregivers. There are helpful tools for caregivers, such as mylifeline.org, which helps people with scheduling and communicating with friends and family around your loved ones' cancer needs, or providing updates and whatnot. And also talk to your loved one's healthcare team and find other local supports. So with that, let's see here. I'm going to go ahead and